Hi, Dr. Applin here with Bethesda Metro Physical Therapy in downtown Bethesda, Maryland. And today we're going to talk about how physical therapy can help with degenerative disc disease. First, we need to find out what degenerative disc disease is. And essentially, it's a specific type of degenerative arthritis. We talked in a previous post about what degenerative arthritis is. But briefly, degenerative arthritis is your body's natural reaction to instability or injury to a joint. And degenerative disc disease is just one specific manifestation of that. And when we start to develop arthritis in the back, or specifically degenerative disc disease, your body is trying to stabilize an unstable joint. And it does this through laying down extra pieces of bone, which we call bone spurs, and it literally tries to fuse the two joints together. And so when we say degenerative disc, first the disc, it's the cushion or shock absorber between the bones in the neck and back. And so when that starts to degenerate, essentially that disc base starts to decrease more and more as your body tries to fuse those joints together. Now, these bone spurs, they literally stick out, and they can push into the muscle tissue, they can push into nerve tissue, and can be very painful. And as the disc compresses more and more, it reduces the amount of space that the nerves that exit the spinal cord and go to your muscles and basically every part of your body. It reduces the amount of space that they have to move and causes this nerve pressure. So when we develop degenerative disc disease, in the beginning, oftentimes there are no symptoms. It usually takes several years before these sort of problems actually manifest symptomatically with pain. But once they do, it can become extremely painful. And what we see oftentimes is one of our patients will come in and say, "Oh, I bent down and picked up a pencil and I felt something give in my back." Well, shoot a series of x-rays, and sure enough, they have degenerative arthritis in the lower back. Bending over to pick up that pencil isn't what caused the degenerative arthritis. It was just essentially the straw that broke the camel's back. It was just that one event where all of a sudden, oh, well, now you're in pain, and now we actually have to do something about it. With treatment, our goal isn't to eliminate the degenerative disc disease, because once it is set in, there's no way to reverse it. But what we can do is slow or completely stop the progression of it and prevent those joints from fusing on their own. We do this through specific manual techniques, massage, stretching, joint mobilization, in addition to specific rehabilitative exercises. If we're able to stabilize that joint where your body doesn't feel like it has to do the stabilization, we can slow or even stop the progression of this disease in your joint. So hope the article is informational, and we'll see you in a couple weeks. Thanks.